From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush. Rob, welcome to the show. It's so great to have you on. I've had the pleasure of knowing you a long time, and we've gotten to riff around where we're going to start with this. So it's really great to formally get you on.
Thank you so much, Brian. I'm really excited to be here and talk about what's going on in the world of healthcare marketing.
And I feel like that's almost the question to start with. You sit in an interesting seat, kind of literally in the work you do, but I would argue even just like the individual of who you are and how many people you know, this pulse of the market comment that I think about of like, where are you seeing the state of the industry?
Yeah, great question. As we were joking earlier, just wind me up and let me go. So as a healthcare market researcher, I am asking questions constantly about what's going on in our world of healthcare marketing. And as we all know, in a good way and in a painful way, things are changing more rapidly than they ever have in the past, at least in my 40 years of doing this. AI is changing everything for us. We're seeing it in all of our research in terms of how people are searching and when they go to a hospital's website or when they don't go. And it's changing how we communicate. I do a lot of ad testing as part of my work. And, the big question is, what is authentic anymore? Is AI authentic? And so let's kind of talk about what I'm seeing with AI disrupting some different things that I think are going to be interesting and things that we have to adapt to. As I probably told you, we have a website pop-up survey that measures the visitor's website experience. One thing that we're starting to track that's interesting, we ask people how they would define themselves. What kind of visitor do they think they are? Like just visiting, I'm a potential patient, or I'm a current patient, things like that. Well, the just lookers, if you will, for the first time, it's declining. So what's happening is people are entering the website farther down the sales funnel. And I think that's directly attributable to AI. So we look at, let's talk about probably the biggest elephant in the room today is zero-click search. And so people are coming in, we're finding that the vast majority of people are actually getting a good answer with AI, so they don't feel they need to go any farther along and do a click. So that's changing the clicks versus impressions. And how are people getting to your website? I think that's one of the main reasons why people are coming into websites farther down the sales funnel. Over the past few years, I've been trying to tell clients, look, your websites are basically a patient journey, and they're not as good of a sales effort. You're not bringing in fresh new people to convince them to become a customer or a patient. And I think now that may not be their role anymore. People are learning about brands outside the website, so that when they go to the website, they're kind of in a buying mode as opposed to a kind of a searching around mode. Like when you go on Amazon, you may just be in a search mode and you're not ready to buy. And that's kind of how we equate that in healthcare. So I think a big change for websites is, why are people coming and what got them to you? Is it clicks like it used to be? And I think that's changing because they're getting their answers, and they're also, if they want more information on a certain condition, or they're just as likely to go to, say, a WebMD or some social media to get those answers. So when they do come to the website, they're there more to do business. Now, why is that important for us? We are finding that in that middle of the sales funnel, when it's conversion time, or just like in Amazon, I'm going to put the product in the basket, or I'm going to go to cart and buy, is one of the areas where we're seeing a big weakness is in physician selection and choice. So that's typically the first point where a person becomes a customer, if you will. It's a translation point or transition point, and that's one of the hot spots on our survey that we're as a industry we're not doing well. So the first time someone wants to be a customer, we make it hard for them. And so I think as websites are looking for ways to improve. It's not necessarily trying to make it a better sales tool. It's make it a better conversion tool. When someone says, I want to be a customer, we should make it so easy for them. That's where Amazon puts most of its effort to make improvements, is in you hitting that, checkout button.
God, there's so much interesting in there. I mean, just recency bias, because it was one of the last things you said. Like, let's start and give me a little more color around what you define by weakness in that choosing a physician interaction, because I can make a lot of assumptions in what that means from the user's perspective. Give me a little more color around
Absolutely
weakness.
happy to. Yeah, absolutely. Yeah. So some of the things where we don't do a good job is we either make it hard for them to find the type of physician they want. I'll give you an example. I typically do this with a new client. I will go into their site and I will go in for a search and I'll say I'm looking for a foot doctor. And often I'll get no replies. There's no physician meets yet, because they want you to check. They want you to type in podiatrist. I know that seems kind of simple and rudimentary, but I'm still finding that problem in today's website. So it's things like that. First of all, we make it hard for them. We don't talk like they talk is still a challenge. So just words that we use are different than what they use. And now with AI, it's not about search words. It's about language and intent. AI is learning, what did Rob really mean when he said he's looking for a foot doctor? What does that mean? So searching is so much more conversational and not just making sure you get the right keywords. Keywords are really taking a back seat now with AI. And another thing is, when they come in, I get so many complaints, like in the verbatims, people saying, why do you show me physicians who aren't taking new patients, or they're not in my network? And then they'll give examples of other industries, and this is important for us. They'll say, would a hotel ever show me a room that's not available? Or would an airline show me a seat that's not available on their flight? And the answer is no. Then they're saying, so why are you teasing me by showing physicians that I can't access, because they're either not taking new patients, or they're not in my insurance network, or what have you. So they feel like our responses to them are not very smart, that we're just kind of throwing out, and we're not, what it equates to is we're not listening to them. So that's a big challenge. People want to be heard. Strong brands really listen and respond, whether it's technically, and it's AI doing it, or it's human to human. People don't feel that we are listening, that the industry is listening to them, and that's a downward spiral for brands.
Yeah, it's funny. You're wholeheartedly preaching to the choir. So
I know, and I feel bad talking. Yeah. I know a lot of healthcare marketers are listening to this, and I know they get it. And that's the challenge we face, is so many challenges are operational based. Marketers, their job is to create consumer demand. They're there to create interest in the brand. Then it's like a relay team. Marketing can run the best lap ever, and they hand the baton off to operations. If operations drops the baton, the whole team loses. And so marketing really has to work closely with operations, more than they've ever had to in the past, to make sure that they're living the promises that marketing does such a great job, messaging.
Yeah, the language piece we've been preaching for 15 years, so that very much hits home, of that closing the gap between what the business of healthcare calls itself and the language of the consumer. And that's always the joke we make of did your patient walk in and say I have a vestibular stenosis? It's they're not aware of how you code and bill for your product. They just know what they're suffering from. And that language side, for sure. And to your point, I think it's just getting exemplified even more, because we're not in this transactional keyword world anymore. It's all these kind of thematic and personalized conversations. So it's just so interesting to see that you have these large scale buckets of data that can start to see this kind of upstream informational volume drop, that they're informing themselves now, it sounds like, before even coming to your website and your brand.
Bryan, isn't this ironic? It's taking AI to have a more conversation at the consumer's level than the actual human beings. So it's AI is teaching us a lesson on how to speak with people. The irony in that is unbelievable.
Yeah, I could derail this call really quickly, but I think there was even some AMA research studies around that came out. They said that they had like a higher EQ and kind of sentiment when speaking to an AI agent versus a provider directly.
Well, look at the research that's on where people are actually developing emotional feelings like love for their AI or their AI assistant. So, I mean, look at robots being created that are AI, and it's like a human-sized doll, but it's based on AI. I mean, they've made so many movies where they all end up being murderers, but in real life, you are seeing AI robots. So things that are in dystopian, futuristic movies are coming true now, and so we can't, as human marketers, we can't let artificial intelligence be more compassionate and emotionally bond better than we do.
You touched upon a word earlier on I'd love to dig into as well. You said the word authentic, that it sounded like you said the consumers are kind of questioning, like where are you seeing that question or where are you inferring that question?
Right. Well, as we write advertising copy and we put it through AI, I've seen commercials. There's one for hunger where there's this young girl, and the first time I saw it, I'm like, oh, okay, that's a real human. She said, I am an AI created composite of what hunger looks like. Turns out she wasn't real. And so now, granted, they were being honest with it and say they were doing that purposely, so that's okay. But what happened? At what point does messaging lose its authenticity because people are like, oh, you didn't write that. That language is too perfect. In fact, I'll tell you, in our market research, one of our tools to spot fraud, like bots coming through, is we have AI that's able to sense that the language used in a verbatim is too perfect, that people don't speak that way. When you have verbatims in a market research study, people use, they'll short, like doctor, they'll go DR, they make spelling errors, punctuation is terrible, grammar is terrible. So when we get a verbatim that is just written in a particular style and it's grammatically and spelling-wise perfect, we flag that as that may not be a human. So we're using AI to catch AI because it's not authentic, because it's too perfect. Humans are not perfect. And so in our marketing efforts, how far is too far before we lose the real human flawed? Being flawed is authentic, and being perfect is not authentic. So we have to ask ourselves, how far are we going to go using AI to create messages when consumers want authenticity? They want genuineness. They want you to be who you are as a brand and stand for something. But if you're standing for something that AI created for you, is it authentic? We're still very early in the stages now, so AI is still a shiny object, and so we're all enamored by it. So everybody's using it to do everything. In fact, many times they're overusing AI. So I hope we settle into when is it a good fit and when is it not a good fit. I don't think we're at that balance yet.
Yeah, and that's a fair point. And I'd almost say, like, if we could somehow put the lens of AI alone or on the side at the moment, where people are accessing information is dramatically shifting. And using your data point, this kind of upstream informational category is dropping on your website. Like, how do you start to think about then what does brand's role play and how is it shift in that search or that search journey?
Yeah. Well, if you think about it, if you do a Google search and you turn on the AI mode, then you've got this detailed answer. So AI has gone out and it's looked at websites that it thinks have the best answer for you, not who has paid to be farther up. So in a way, AI is the great democratizer, not the great monetizer for information. So what's happening is I talk to friends who are in the digital and content space. What they're saying is, at least right now, because Google hasn't figured out a way to monetize a zero click, because if you don't click on anything, who gets money? Nobody gets paid, right? Or no one is paying for that. But what it means is the content they're finding, AI has become the judge of what is good information. So what my colleagues in content management are saying is, it's actually, for now, it's a good thing, because it's making brands really focus on giving good content, not just trying to line up with keywords that will trigger. To me, that's actually not very authentic. If you're just, it's like with job searches nowadays, kids aren't writing a really thoughtful resume. They're writing a resume that will have keywords that will get them into the queue. And so I don't think that you're playing to how you're being held accountable. So brands are being held accountable in their content to clicks, not what is honest, authentic, useful information, putting the patient first, not the clicks first. And so for now, the great equalizer is AI. It's picking what sites it thinks are doing the best job to answer that question without who paid for that. So it's going to be interesting to see how that plays out over time. But I like that, because I think good content should win. And the problem is, all of these, like a Google, they got to figure out how to monetize that. And so, for me, in my perfect world, I'd rather have Google charge everybody an annual membership and then make it so there is no clicking. It's just who's doing the best job. Now, as a guy who loves, I've got a background in advertising. I love to test ads. I'm always like, what ads resonate better? And, we have over-rotated on performance marketing. I am a big fan when you look at brand building advertising and then performance marketing. Brand building is a long-term playing chess, thinking several moves out. You're building a connection emotionally with people so that they have an affective affinity for you, whether they've used you or not. Then that will help make it easier for you to go out with performance marketing, which is more call to action, where you're basically asking for business. What we're doing is we've over-rotated, and we're doing so much performance marketing, we're not doing enough brand building. So we're seeing performance marketing, it's not giving us the results that we want. I use the analogy, no one would ever ask someone to marry them on the first date. You can't ask for the clothes before you've built a relationship. And I'll tell you who we learned this from, and we should have learned this from. I'm from Detroit, so the automobile industry, they ruined their brand by telling people, don't buy a car unless we give you money off. So, it's funny, cars were doing kind of performance marketing, or more what I call to action marketing. They were doing it before it was a cool thing. And it destroyed their brand, because people don't care about the brand, they care about how much money they're going to save. And it really hurt them. And they're still paying for it. So we should learn from that. The ratio that all the research I read about advertising worldwide that's been done is 60-40. 60% brand building, 40% performance or call to action, if you will. I think we're like 10-90. We have so over-rotated. It has a place, but as my mom used to say, even too many green beans is bad for you. Life is about balance. And I think we're out of balance when it comes to brand building versus performance marketing. But I understand why. There's so much pressure to get people using our products and service lines right now. So we're playing checkers and not chess, because CFOs and COOs and CEOs, they're pressuring, they want results now. That's so short-sighted. And then we wonder why we're not getting the type of response that we want. Now we enter in AI, and what's going to happen is clicks are they really going to be valuable anymore? Because what are they going to look like? Where are people going to click? And now it's going back to impressions. I think, and this is where Rob goes out on a limb and has his predictions, I think we might see a renaissance of more impressions and brand building. And we're going to focus on content for what's really relevant to people. And then we're going to do more brand building. That's where I would like to see us. I think that's a long-term, smarter play, but I understand the pressures for short-term. It's easy for me to sit here and pontificate. I don't have to, be at a particular health system and have the CEO call me in. So I'm saying that to everybody watching this. I I understand what you're going through. I'm just trying to tell you what I'm seeing and what I think, the future is going to look like.
Yeah, it's funny you kind of went out there with your prediction, but I'd be curious for you to almost like push back on this thesis that I'm going to lay out of.
Okay.
I agree with you wholeheartedly. Like in an aggregate, there's an overabundance on the performance side, and just psychologically, we're all kind of attracted to this short term. Like I can win within a 30-day window. Like Google Ads is the end all be all with metrics. And if we need to shift more towards brand, my concern is that the shift at this moment in time, the shift towards brand is now even more complex. And I'll give really specific in that AI overview, it's referencing often 3, 5, 7, 10 sources in aggregate. So I read that scenario that you have to now own your brand narrative in a larger volume and just complexity of spaces and moments. So I'd be curious your thought on just like, if you want to shift towards brand, like how do we begin to tackle that when it's not now just like your website, this singular source and this complexity of sources that an AI is pulling from?
Well, I'll tell you, as a brand guy and a real proponent for branding, strong brands are true to themselves and they have their swim lane. We are this brand. This is what we stand for. We're not going to veer off that. We're going to be consistent over time. We are going to own our brand character, our brand tone, our brand messaging. I think AI is looking for consistency. So if you're hitting in the right lane and you stay there, AI is going to start picking up on, once it sees you for content, then it's going to start seeing you because you're not all over and having inconsistent. That's one thing we do in healthcare is, unfortunately, I call it branding ADD. We do one thing for one ad, then we switch it up. You can look at the different ads from the same brand, and they don't always have a tight brand character. Like a McDonald's ad. You can look at McDonald's ads over the past 10 years. There's nobody that's saying, gosh, I don't know who that was. Their brand positioning is so clear. It's so consistent. The tone, the character, it doesn't vary. Nike ads are the same way. That's why they're such dominant brands. We are really struggling right now in healthcare with what I call death by vanilla. What I'm finding in my brand research is more and more people are saying, there's really no difference between these brands other than where they're located. Can my doctor admit there? And are they in my insurance network? That's why I'm calling it death by vanilla. So we aren't giving people meaningfully differentiating reasons to pick us over someone else other than market factors, convenience, network, and doctor admits there. Those are table stakes. Those should not be brand differentiators. So if there's ever been a time where we need to come back hard on brand building in healthcare, I think it's right now. And I just because there's many more places where it's going to show up, it actually makes having all of your content go through your brand lens. I think that's now more than ever. I think it will make you more visible, not less visible.
That's so interesting. I read that as almost this like self-sabotage in the industry, that you're positioning yourself transactionally to the market, so then people don't even know what your difference is. And like, we love this word authority we kind of own. And I'm listening to you going, there's such an opportunity for healthcare brands to just really know what they are an authority in and position that into their brand now, because we haven't been.
Yeah, and I would say even more than authority is what is their true authentic self? What is their true north? What do we stand for? And is that meaningfully differentiating to our audience? And part of that is that authentic self is people see you as, everything they do is within that what they've said they stand for. It gets expressed everywhere. We want to say we're a health system, but it was interesting, just to digress here a second. I started doing system research back in the mid-90s. And what I found nationally, the two things consumers wanted for a system to have any value to them was, I want a single bill and I want the left hand to know what the right hand's doing. Those are the top two things. 35 years later, we don't do either very well. We still can't do a single bill. And half the time when they go into one of our locations and they go to a next one, they're not expected. They're like, oh, who sent you here? Oh, Dr. Smith, he never sends over the, you know what I mean? So we don't act like we're one family. And so we wonder why people don't appreciate, health systems. It's because we do a lousy job really being one. And especially with all the mergers and acquisitions going on now, M&A is making that even more complex, because you once were competitors and now you're not the Brady Bunch. Now you're coming together and you have different systems, different styles. Everyone's fighting for their job. And so it makes you even less systemy to patients.
Yeah, it's funny just to follow your sidebar even more. It was a couple dozen conversations ago. We were speaking to a woman that helped advise to a technology that just simplified billing. All they did was exactly that, was how do we synthesize all your billing paperwork into one communication to that patient and then make it easy for them to pay. Like, shockingly how massive that company is just trying to solve that pain point alone.
Well, again, I love how sometimes we digress, but this is important.
Yeah.
So in my research, I am always asking in my national NCIS studies, I call them the trouble bookend children. And it's upfront pricing and back-end billing. So if we don't fix those two things, everything we're doing in terms of the patient experience during the experience is going to go for naught. We're going to lose their trust. Here's what I mean by that. Up front, people are more likely price shopping than they ever have, because since COVID, people are afraid of their finances. We're not in a comfortable time right now financially. I see I watch the finance shows on TV, and they're like, we have the highest debt that anyone's ever been in per person in the country, and that's got to make you uncomfortable. So more and more people are price shopping. Here's what we do that's losing trust even before they use us. Say I need to get an MRI, and I call, and they say, well, if you go to our hospital, and I can't remember, I'll make a number up. It's $1,400 for the MRI at our hospital, but if you go to one of our outpatient centers, it's $800. That drives people nuts. They're like, what are you pulling on me? You're the same brand, but I have to pay more at the hospital, and then we give them the excuse. Here's the worst things you can say to a patient, but we do it all the time. You have to understand, at the hospital, it's more expensive because of this. Consumers are like, no, I don't need to understand. You need to understand I can go somewhere else. And so we are making excuses for our crazy ways we do things. So you're losing their trust before they use you. Then they use you. It could be a great experience on the back end. Now with billing, all my research shows people want a single bill because they know that you have other people you have to pay that may not be part of the system. But what they're saying is, I'm sick and tired of being your accounting department. You figure out how to pay those people and send me one bill. And if I don't get the bill within 1 month of service, I shouldn't have to pay it. How's that for the new consumer? I think I did a focus group a few years ago. I'll never forget this lady, and I don't need to do any more research on the subject other than what she said in a focus group. She's sitting to my right. She's waxing poetic about how wonderful the experience was, because we were doing some journey mapping. She was telling us, walking us through how everything was perfect at this health system. I can tell they're smiling behind the glass. They're happy as can be. Then all of a sudden her tone changes, and she looks at me and she says, and then I got the bill. And I'm like, uh-oh, here it comes. She says, I had my experience in the spring. I thought I got all my bills. I paid them all. Then come fall, I'm doing my family budget, and I put money aside for our family vacation every year. She said, then I get this bill out of the blue from this system, and I investigate it, and I find it was for this springtime, experience. And I look, I call, and I find out I really do owe it, but I had no idea. I thought I had paid everything off. So she said I had to pay the bill because I don't want to, not pay it. She said, and then I had to cancel my family vacation. Then she turns to me, she puts her finger right in my face, and she says, and now I hate them. I will never forget the look on her face of how angry, and putting her finger in my face when I don't work there, but she was so angry, it ruined her whole experience. So if we don't figure out the trouble bookend children, we're never going to really regain people's trust because they think we're pulling a fast one on them. And what's the worst thing you can do to a person is go after their wallet.
Yeah, I'd be curious. You're bumping into, to me, reputation. And I'd be curious, you could take this door in a couple of different ways, but to me, historically, the majority of bad reviews have been around administrative and billing problems.
Yep.
Right? That is, to me, the bookend. I'd be curious, has your view on reputation, how to approach it, its value been evolving?
No, it's reputation and brand are two different things. Some of my clients, their leaders think they're the same thing, and they're not. Reputation is separate and has nothing to do with brand. It has to do with what kind of company are you? Are you known for being honest and do what you say you're going to do, and you're doing the right things? It's you can Starbucks can have a good reputation for being a good place to work, and they care about the environment, things like that. That has nothing to do with their brand positioning against the competition. So reputation is critical because you can't have a strong brand if you have a bad reputation. Reputation is just about who you are as an organization. Brand is how you differentiate yourself to make people want to use you and keep using you. So it's really important we separate those two concepts out. And we are paying lip service by doing online, digital reputation management, which is important because how people talk about us creates our reputation.
Maybe I'll dig in more, and that was my own false labeling of, I hear patient review, I think is maybe the word I was more thinking of. Mm-hmm. Is that angry person is going to go shout that somewhere now too online. Where are you seeing reviews within kind of the digital landscape, and is that evolving at the moment?
Oh, yeah, thank you. Yeah. So here's another where Rob sometimes gets himself in trouble, but I just call him as I see him based on my numbers. So the days of professional experts where everyone listens to them is going away. We don't listen to having that newscaster that was on NBC or ABC or CBS, that's where you got your news and you trusted them, or certain publications, you trusted them, the Good Housekeeping seal of approval, and now we have US News or JD Power. Those expert sources, people don't trust anymore like they used to. Who do they trust as the expert? It's online, it's influencers, it's patients who give reviews. Today, people care more about what people like them have to say about a healthcare brand rather than what some award that you've gotten. Most people think, how much did you pay for that? So there is no credibility because it's viewed as you're bragging. Oh, we're ranked number 1 in US News. Consumers are like, who cares? I didn't give you that ranking, so it's invalid to me, and you probably bought it anyway. So I think in 5 to 7 years, US News probably will be gone. In a focus group a few years ago, a youngster I was in my focus group we were talking about US News. He goes, yeah, I think that's the magazine my dad used to read. So I call that Death by Buick. So that US News is absolutely waning, and I think going away. What's on the rise? All my research, no matter how I ask the question, it's across all my studies, it's about patient reviews. So don't spend money on buying the badge and advertising it because you're seen as bragging about yourself. That is not authentic. If people trust you and think you're good, it's up to them to tell you. But if you talk about it, here's a fun analogy. Do you think Tom Hanks ever goes out and brags about what a great actor or person he is? No. When people tell him how wonderful he is noticeably shy and humble about it and grateful, because trust and reputation, it is given to you by people. You have to earn it. You don't talk about it. And so these awards are seen as saying, oh, look how wonderful we are. No, people are like, no, I'll tell you if you're wonderful. And how do they do that? In their reviews. So I would spend my money on making sure that I'm engaging and managing my online patient reviews, because that's what people are looking to today.
Loving Tom Hanks seems like such an appropriate place to end, but I always love like we had so much we could have talked about. Is there anything just like bursting at the top of Rob's mind that we should still cover or that you wanted to talk about?
I'm 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 looking at my notes to see if maybe I have. One last thing about targeting with Gen Z. So I'm also studying this. People, brands have to love people before people love brands. And so many of our clients, they're targeting older people who are more likely having more serious situations. But we're missing the fact that the battle for market share growth is going to happen at the top of the sales funnel. We are so focused on fixing people when they're sick and injured and it's serious that we aren't walking with them when they're healthy. And especially Gen Z, fortunately, their sick days are maybe ahead of them. They're mostly just bumps and bruises. They need primary care. The vast majority of Americans, fortunately, are basically healthy and they need primary routine type care. If we don't bond with them at the top of the sales funnel, we are not going to get them at the bottom of the sales funnel because all my physician work is showing that physicians are telling me in all my studies that, look, over the next 5 to 7 years, it's going to become almost impossible for me to refer outside my brand family. I'm getting so much pressure to stop the leakage. And I mean, we all, as systems, your job is to keep your physicians loyal. And why not? You want all the business to stay. So if everybody's successful at that, there's not going to be much outflow. It's going to be the exception to the rule. And so if you're relying on more of a B2B strategy with referrals because you want to be a destination hospital for tertiary and quaternary care, you're going to find yourself in a world of hurt market share wise in the coming years and decades. So we have got to focus on owning that top of the sales funnel. That's absolutely key to growth. And where do you do that? You start when they're young because you have to invest in people before they invest in you. I can leave you with one example on that should really hit home with people. Back in the early 80s, I was in banking before I got into healthcare. One of my first, as a researcher, one of my jobs was we were going to do this new seniors financial package that we wanted to market to seniors. So I did a bunch of focus groups. I'll never forget this. I say elderly lady. Gosh, she's probably my age now. I'm now her. But she said, "Look, when I was young and poor, your bank wanted nothing to do with me. Now that I'm old and rich, you want my money? Forget about it." I'll never forget that. 45 years later, that lady's explanation of, "You didn't invest in me, why should I invest in you?" We have to heed those words today. We have to play chess and not checkers. It's about lifetime customer value. It's not about short-term P&L. We don't change the way we look at investing long-term, then we're just chasing short-term, and that's a fool's errand.
Yeah, you trigger so many associations in my head. I think you really like a colleague is a physician, Jay Parkinson, we've spoke to and actually co-hosted with me in a couple episodes that he built one of the most kind of one of the first virtual primary care platforms. And he's been preaching, I think what you just said for decades of this, like, how do you invest and own the beginning of the episode of care?
Right.
And this was remote primary care before anyone even knew what remote primary care was. So how do I make it as easy to get access to care as possible, but then carry and be the partner with that person when it becomes more invasive and further down the episode of care? And that was 20 years ago, 25 years ago.
Yeah, and it's even more true now.
Yeah. So I really appreciate the time as always. I know you got a lot going on in your life personally too. So is there, like, you have so much knowledge and expertise, is there a better way for people to engage and kind of stay in your ecosystem with you online?
Oh yeah, I'd appreciate it. Well, obviously you can follow me on LinkedIn, but also if you just go to our website, we put all of our research under our knowledge center. So as I said, I every year I do what we call an NCIS, National Consumer Insight Study, and this year we focused on peds. So it was all about how parents make decisions for their children's healthcare. And a lot of it is digital. Where do they go online? How are they doing searching? Things like that. So if you just go to www.kleinandpartners.com. So it's KLEINAND, partners, plural, like you can kind of see on the screen above my head, .com, and go under the Knowledge Center. It's free to download. This is kind of, I do these studies every year as my gift to give back, say thanks for 20 wonderful years that I've had with working with friends. And so download it. And if you have any questions on it, I'm happy to chat. And also the 2024 study was with adults. So that I think that information is still relevant.
Cool. I'll be going there. I'm that parent in that toddler pediatric decision phase at the moment, so I'm just super curious.
Parents will go to bat for their kids more. They'll put up more for themselves. We'll put up with kind of indignities for our own healthcare, but I tell you, their children, you better be spot on with the kids.
I can validate that for sure. I appreciate it, Rob. It's always so great to talk to you, and I'm sure we'll be talking again soon.
Awesome. Thanks, Bryan. Good to see you, my friend.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.